In today's video, we're going to be talking about Modafinil or Provigil. So this video is in response to two different subscribers, Danielle Velling and Petals, and answering their questions about Modafinil or Provigil. If you would like your mental health care questions answered, please go ahead and put that in the comment section below, and I'd love to make a video specifically for you. So without further ado, here we go. The first thing is, what is Modafinil? Well, Modafinil is a stimulant medication, but it acts differently than your other typical stimulants, such as amphetamines and methylphenidates, in the fact that it doesn't have any dopamine releasing properties, and very similarly to bupropion, which I cover in this video, it actually is a dopamine reuptake inhibitor. And it's considered a weak inhibitor of this dopamine transport system. However, the plasma concentration of this medication when taken is high enough to achieve substantial actions on the system. Along with increasing actions on the dopamine system, it also increases wake-promoting neurotransmitters from the hypothalamus. Furthermore, because it does not have dopamine-releasing properties, Modafinil is seen to be less abusive or have a less abuse potential than your traditional stimulants. However, it is still classified as a controlled substance and does have the potential for abuse and dependence. So the second thing you need to know about Modafinil is, what is it used for? So Modafinil is used to stimulate wakefulness in narcolepsy and obstructive sleep apnea when used in conjunction with a CPAP machine as first-line treatment. Modafinil can be used if you're still experiencing daytime sleepiness with obstructive sleep apnea. It's also used for sleep work shift disorder, where light therapy is actually first-line treatment, which I discuss in this video and mention the light box, the 10,000 lux of light that you can use to set your circadian rhythm if you're working night shift. But if you're doing that and you find that you're still having significant daytime sleepiness, then using Modafinil would be beneficial for you. Now, there are also many off-label uses of Modafinil, such as adult and pediatric ADHD. It can also be used adjunctively for treatment-resistant depression or patients who have depression and they're still experiencing that fatigue, that lack of motivation and lack of energy. Modafinil can be used to help with those specific symptoms. And also for bipolar depression, but should be used cautiously because it can switch a person with bipolar into a hypomanic or manic episode. It's also used for patients who have chronic diseases that result in chronic fatigue, such as cancer, multiple sclerosis, HIV/AIDS, and things that cause chronic fatigue. Modafinil has been used adjunctively to help promote wakefulness in this population. There's also evidence that Modafinil can also be used for cocaine dependency. And this is an area that I'm very unfamiliar with because I do not specialize in addiction medicine. However, the studies show that using Modafinil to help someone overcome cocaine dependence has been shown to be beneficial. And like I mentioned before, the abuse potential is low, and so patients are able to then come off of Modafinil without having to be dependent on it and be free from cocaine dependence as well. However, the evidence for this is very mixed. And so some studies showed positive effectiveness and others did not. So that would be something that if you're suffering with cocaine dependence, that you would have to have that conversation with your provider to determine if Modafinil is the right form of treatment for you. So number 3 is, what are the common side effects of Modafinil? And as you know, All medications come with side effects, and modafinil is no different. And so the common side effects that would be experienced by about 10% of those who take modafinil will be headaches, nausea, and decreased appetite. And then the less common side effects, which occur in about 5 to 10% of those who take modafinil, would be anxiety, insomnia, dizziness, diarrhea, and rhinitis or runny nose. And there are a couple of rare, dangerous side effects that you should be aware of. So not to scare you or anything, but modafinil has been shown or linked to what's called Stevens-Johnson syndrome, which is a very severe form of a rash that looks a lot like sunburn, which can blister and then begin to peel, and in its worst form can turn into what's called toxic epidermal necrolysis. And so this is where the skin starts to detach from the dermal layer and starts to slough off and die. And this is where it can become very dangerous and life-threatening. So anytime someone with modafinil has any type of rash, it is recommended that they stop this treatment and go with something else just to avoid this from occurring. Another dangerous side effect, but very rare, is another type of rash that's called DRESS, or drug reaction with eosinophilia and systemic symptoms. And basically what this is a maculopapular rash, or like a bumpy red rash, but also systemically speaking, meaning in your body, you'll have high levels of eosinophils, which are the cells that respond to allergic reactions. But when they are in high numbers, when they are in your system in large amounts, it can actually cause organ failure. And so that's how this type of rash or DRESS can lead to death and be life-threatening. So again, that is why anytime you have a rash, when you start taking modafinil, when you're on modafinil, that your provider will decide to switch to an alternative medication. So the last thing, or the fourth thing that you need to know about modafinil, is that it can cause drug interactions. It's a moderate inducer of a metabolic substrate, which a lot of medications get metabolized by. And it's also a weak inhibitor of a different substrate that some medications are metabolized through. So that's why it's very important for you to have this conversation with your provider, and that you mention the medications that you're on so that these drug interactions can be avoided. And the most common drug interaction that I see and that I make sure that my patients are aware of is the birth control. It can actually decrease the effectiveness of your oral birth control pill. And so if you are taking oral birth control and you are on modafinil, it is recommended that you use an alternative method of birth control. But again, that's something you want to talk about with your provider. So that's it. Those are the top 4 things that you need to know about modafinil. Did you find this video useful? If so, make sure you share it with others and spread the word around and let them know what modafinil is all about. And if you would like your questions answered, then go ahead and put that in the comment section below and let me know what topics you'd like me to cover in relation to mental health, because our goal here is to improve your mental health care journey. I thank you for watching, and I'll look forward to seeing you next week.